Senator, the star from the Midwest, Senator Ernst.
Thank you, Chairman Booker and Ranking Member Braun, and our chair, John Bozeman, as well. Thank you. This has been a great panel. Thank you all so much for being here. I really appreciate the time to talk and hear about some of the initiatives that we see across the United States. And I'm going to divert a little bit and talk about a pressing issue that we have out there as well, because this week we are going to be voting on the National Defense Authorization Act. And most recent statistics that are out there, only 23% of Americans aged 17 to 24 actually meet the necessary qualifications to enlist in our United States Armed Services. And there are many things that will cause folks not to qualify for military service. There's a lack of education, there's obesity, and other disqualifying health issues. But when you look at just obesity, out of those that don't meet the necessary qualifications, 27% are obese. And most of that is, of course, related to their nutrition and exercise or lack thereof. So I just wanted to bring up that issue. I know it's a topic for another day, but making sure that our children and young adults have access to healthy foods is extremely important, not just across the board, just because we want to be healthy Americans, but because of our readiness issues with national security as well. So I wanted to take that twist. But if we can come back to some of the programs that we're offering, many Iowans, both our children and adults, will suffer from digestive or inherited metabolic disorders. And I've worked with a number of families in Iowa that are dependent on medically necessary foods, vitamins, amino acids for their treatments. And unfortunately, the products come at a very high cost to those who depend on it. And that's why I am an original co-sponsor of the Medical Nutrition Equity Act. All Americans deserve to know that they are covered for their medically necessary nutrition under federal health programs and private health insurance to support their proper growth and development and to prevent other types of medical complications. I've also heard, as many have from Iowans, about incentives-based approaches as a preferred method to empower SNAP customers to purchase healthy foods. An example of this is the Healthy Fluid Milk Incentives Projects program, which I led and was established in the 2018 Farm Bill with the goal to help improve nutrition security for SNAP families through healthy and nutritious dairy products. And I also want to note that there is a project in Newark that I think Chairman Booker has maybe visited, and that's important as well. The dietary guidelines for Americans have repeatedly recommended milk and other dairy products as critical for a healthy meal pattern, and under this Healthy Fluid Milk Incentives Project, shoppers that use SNAP benefits to purchase a qualifying fluid milk product also then receive a matching dollar-for-dollar coupon to use for additional free milk or other types of healthy dairy products. And Mr. Richards, I see you nodding your head there, and I know that you are supportive of these incentive approaches for those nutritious dairy products. Can you talk a little bit more about those types of incentives or those types of projects?
Sure. Yeah, because I mentioned Kentucky Double Dollars, but it is actually 4 incentive programs, right? So there is the SNAP fruits and vegetables, which the GusNIP grant has typically done. But we also double up WIC and senior farmers market nutrition programs. But then Kentucky is a livestock state too, right? So we double up meat. We have meat, eggs, and dairy double up for it because we recognize all those benefits and the fact that access to high quality, healthy protein is just part of a good diet. So it's all Kentucky grown meat, eggs, and dairy. That's for everything. But yeah, as a former livestock farmer, and my grandfather was a dairy farmer, so I'm right there with you, Senator.
Outstanding. Well, I appreciate it, and I am running out of time, so I just want to once again thank our panelists. Extraordinary. Thanks for what you are doing for your communities and, of course, for the greater health of our nation. We truly do appreciate it. Thank you, Mr. Chair. I yield back.
And thank you, Senator, for mentioning the Medical Nutrition Equity Act. It's